Hello, welcome to another info session with Dr. Dzubur and
Dr. Zielinski.
Today we'll be talking about glaucoma.
So, what is glaucoma? How do you explain that to your patients, Dr. Dzubur?
That's a good question. So when I explain glaucoma, I try to make it as simple as possible because it's really hard to understand sometimes with patients and with people where glaucoma doesn't really affect straight ahead vision. And a lot of people will say, well, my vision is great. Why do I have glaucoma? I don't feel like I do. So glaucoma doesn't really affect straight ahead vision. It affects your peripheral, your side vision. So the vision you don't really even think you're using, but you're using it all the time when you're walking, when you're moving around, you're walking through a hallway, especially in nighttime, because that's when it really kicks in. So in a nutshell, the way I explain glaucoma is I consider the whole eyeball as a balloon system. So you have the eye as a balloon. There's only one way in and out of a balloon. So when you blow up a balloon, you can blow it. If you blow it too much, all the air kind of wants to come out the same exact way. And I kind of describe the eye system the same way. So it's an enclosed system, but there's only one way in and out of for information to go. So there's cells back over here that produce this clear fluid in our eye. And that fluid kind of travels around our lens and our iris and bathes all those systems and keeps those areas alive. Otherwise, we would have an eyeball filled with blood. You can't really see through blood, but you can see through clear fluid. So that's why this fluid is always being made, is always supplying our iris and all those areas with the nutrients they need to stay alive. But what happens sometimes is the equilibrium between how fast we make that fluid and how fast we drain that fluid gets out of whack. So we're making it real well, but we're not draining it as well. So what happens then is this balloon system, our eye, the pressure starts to creep up. And since we said there's only one way in and out of that balloon, the pressure tends to start kind of pushing on the nerve gently. It pushes on the nerve, and after weeks, months, years of this consistent pressure on the nerve starts to sustain damage. And when the nerve starts to get damaged, our peripheral vision starts to have similar damages in it. The trick is we always have two eyes open. So it's really tough to have any signs or symptoms of glaucoma. So I call it the silent thief of sight, so to speak. It very sneakily takes away your vision without you even noticing it until it's almost too late. So now I'm gonna ask Dr. Z to get a little more in depth with this. I made it very, very simple. She'll talk a little more in depth about glaucoma now. So you tell me.
So Dr. Dzubur is right. When that fluid is not flowing out properly, the pressure can go up. When that pressure goes up, it puts a lot of pressure on your nerve in the back of the eye. He was pointing that out before. And so when there's all that pressure on the nerve is not getting good blood flow, it's not getting nutrients, everything that it needs, and so the tissue of the nerve itself starts to die. That nerve is responsible for all of your vision. But with glaucoma, the first vision loss is in the periphery. And so that's why it's important to come for eye exams, because even though you may feel your vision is fine, you're seeing well centrally, if we notice a high eye pressure or we notice that the nerve is looking glaucomatous, we need to do further testing. That being said, people with normal pressures can develop glaucoma as well. And so for one person, a normal pressure may be just fine. For another person, that quote unquote normal pressure can induce glaucoma. Everybody's a little bit different.
Yep, so going back on that, everyone can have a different pressure and every eyeball can handle pressures of different levels. So a pressure of 20 for one person is completely normal, can be devastating to another person's eye. So everyone's pressure has to be their own. So there's no one special pressure that works for everyone. So with glaucoma, you can have, like we said, normal tension, or we call it low tension glaucoma, where your pressures look completely normal, but you still are experiencing damage to your nerve. That's because even at those pressures, your eye cannot handle that. So we need to even bring that down even lower. And then we get into the discussion of, well, is it only pressures? Well, it's not really only pressures with glaucoma. There's a lot to do also with vascular supply to your nerve. So if the nerve is not receiving adequate vascular supply, so blood, which means oxygen, it starts to get damaged as well, just like from the pressure. So we have to play this fine balance between making sure the nerve is properly oxygenated or perfused with blood, and as well as the pressure in the eyes at the optimal level to take away pressure from the nerve to reduce future damage. And that's pretty much how we treat glaucoma. We put you on eye pressure drops, or we do laser therapy, we do other kind of treatments, and they're all aimed at one thing, and that's lowering the pressure that you have today for a lower pressure tomorrow, so we can take that pressure off the nerve, so the nerve can survive long term, so it can outlive you, so to speak. And that's what kind of what we focus on when we talk about glaucoma, when we talk about treating glaucoma. Anything you want to add?
No, I think that pretty much sums it up.
And that is today's Info Minute.
Info minute.
Info Minute is what I like to call it.